Enhanced recovery after surgery is not a new technique or modality. It's been around since the 1980s. Was developed by a gastrointestinal surgeon from Europe. It really has started to come into emergence and take hold over about the last decade, just under about a decade. And part of that is number one is patient outcomes, is trying to get better outcomes. The other piece of that is there's an economic impact with respect to services rendered to patients, and are patients getting for every dollar spent the outcome that they desire. And I think one of the things right now is again, enhanced recovery after surgery is, I would say it's coming out of its infancy, if you will. Particularly because everybody asks for well, what's the protocol or what's the recipe to doing this, and there is no one recipe. Every patient is an individual, and we have to manage those patients according to their needs specifically. There are technologies now that are emerging like genomics that will enable us in the near future to be able to even tailor the medications specifically to that individual as we move forward, which will only enhance, enhanced recovery protocols, if you will. There's hundreds of protocols out there, and that's why, when somebody asks, is there a protocol, or there are definitely frameworks, but the rationale of why we've got so much education behind us is because it's now the art and the science that are coming together. So. While enhanced recovery is the buzzword out there now in the community, I think it's here to stay. The impact is astronomical by comparison to what we used to do and what we used to see in outcomes. I'll give you an example in my practice setting. Lower abdominal surgeries, which I work for a cancer hospital. And those procedures typically will last 12, 14, sometimes 16 hours in duration. Those patients usually would have a hospital length of stay somewhere around 12 to 14 days. We are now getting those patients out of the hospital about 2 to 4 days after surgery now. So we're removing almost an entire week of hospitalization off of length of stays. Not to mention patients are ambulating within, or walking around now, within a couple of hours after surgery, as opposed to historically, prior to implementing enhanced recovery after surgery or ERAS protocols, they would be laying in bed for days. And so, that's an example that's fairly extreme, and I think the techniques are applicable all the way to same day surgery where people are going home, and part of that is more the activities that patients have when they're discharged, as well as the medications or the regimens of medication administration that they are prescribed. Enhanced recovery after surgery, those strategies can happen in a short stay all the way through to lengthy hospitalizations. Yeah, not just hospital or insurance companies, hospital systems, the providers, we're with the advent of macro, which is now the reimbursement changes that have happened under CMS in 2019 here in the United States, there's more shared risk on hospital systems as well as providers. And so it's incumbent upon all of us to start to develop these tight networks and teams to be able to work together. Insurance companies as well as the federal government. Now you can go to physiciancompare.gov, hospitalcompare.gov, and start looking at some of these outcome measures that, to be competitive, I think moving in the next 10 years, you will have to have adopted some form of ERAS strategies in your hospital system without question.